It is the voice of Indiana County, WCCS, AM 1160 and 101.1 FM. And good morning to you. We're on the line this morning with Brett Braun, the Chief Operating Officer of the IRMC Physician Group, and our conversation brought to you by Marcus & Mack, a law firm representing injured people. Brett, good morning.
Good morning, Todd. How you doing?
Wonderful. It's good to have you on the air with us today.
Well, thanks for having me.
Well, yesterday we got the news from Governor Wolf that, the loosening has begun of some of the restrictions on everything across our society, and that includes some of the medical care that will now be available to us that had been restricted, and that includes elective surgeries, and that means that hospitals are going to begin the very long process of getting back to normal operations, and it's going to be a while before we get there, but how does that all come to be at IRMC? What are the steps that need to be taken?
Well, I mean, if I can go backwards in time a little bit, Todd, I mean, if you go back to March when we started the community to social distancing, that happened on March 13th. And so since March 13th, IRMC has been doing many things behind the scenes to prepare for this exact moment to the reopening aspect of it. You did mention that it was about getting back to normal, but I don't necessarily know how long that's going to take, but it's a slow ramp up. But I will tell you that since March 13th, I mean, we've done everything we can to keep the patients and community and even our staff and physicians safe from COVID-19, from screening patients before coming in for visits, screening them coming into the office, self-monitoring our staff, also having a masking policy, also limiting visitors into the office. And I think we've done a good job in those practices that we're here today because of those. Behind the scenes for the surgeries, elective cases, when we started to reschedule them or to delay them, we used the auspice and the guidance of the government to say, look, if you feel like you could push this case back 8 weeks or longer without doing harm to a patient, that was sort of the criteria that we were utilizing to reschedule people. Well, now we're kind of at that 7-8 week mark or getting close to it, that the question is how long do we really want to delay any further? So we've already been having discussions about this behind the scenes, creating protocols to keep people safe. We're actually going to be doing testing preoperatively on every patient, so therefore that's one more element of safety that we didn't have before. So I'm confident that we are going to get back to a new normal, but slowly and safely.
Yeah, absolutely. And I'm sure that the review process has been continual as you look at, what are we doing now? What will we be doing a day from now, a week from now? And what are the practices that we can institute to be absolutely certain that we're as safe and as clean and as protected as we possibly can be?
Well, that's a great question. And I'll tell you one thing that I'm proud of, and to my knowledge to this date, not a single IRMC Physician Group staff member, physician, or even patient has actually contracted COVID-19 and come down with it, whether it be in the office. And I think it's as a result of the safety practices we did put in place. I mean, and if I mentioned correctly before, I mean, we did talk about limiting visitors. We did talk about screening patients. We did talk about maskings. We continue to limit the number of patients in the office. And the one other thing that's new to this matrix is the fact that we're utilizing telemedicine to help augment some patients' needs. So during this whole time frame, we were still available to patients to take care of them. But I think moving forward, we're going to continue to utilize telemedicine where appropriate. I think we're going to continue to limit the number of patients or the way we space them out in an office just to continue safe practices. Therefore, we don't have to be concerned, or we should try not to be concerned about another outbreak if we continue these practices.
Telemedicine has been a revelation, hasn't it?
Oh, my gosh. It's amazing. I can tell you that we implemented telemedicine on March 23rd here in Indiana, and before that time we had 0 telemedicine visits. Now the telemedicine visits represent probably about 55 to 60% of our visits at the current state. And I will tell you that certain specialties actually are more prone to do telemedicine, not just today, but I think even moving forward, that we're actually really seriously looking into it for the long term. And I think one of the reasons that it became so successful was because, again, people still need to have care, but they need to have the care provided safely and convenient to the patient. But the government also limited or loosened a lot of restrictions on telemedicine, given this current pandemic that we're in.
Yeah, and it's interesting to me because you read more and more about it and you see what they are learning. Even the people who are in government and in medical circles, they're learning how telemedicine can be applied in ways that they probably never thought of before. So the question becomes then, what's the model for me for receiving care from IRMC Physician Group, since you represent IRMC Physician Group? I have a problem. I need to go to the doctor. I need to have a doctor's input on this. What am I supposed to do? What are the steps that I follow?
I think the first step is to call your doctor's office, whether it be their doctor's office number directly, or you can call our patient services line at 1-888-452-4762, which is 1-888-452-IRMC, and just ask the question. I mean, during this whole time frame, we are really sending the message to our staff, to our providers, to our patients that, look, do not delay your care if you need care. And it is a safe way of doing so via telemedicine. And again, going back, if you need to be seen in the office, we'll see you in the office. And I just wanted to send that message out to the community to not delay your care if you need care, and make certain that if you have any questions, reach out via the phone and at least get in touch with the doctor's office, and then decide for yourself where the care best suits you.
Yeah, and there will be some instances when they say telemedicine is going to work best for you and we can make that happen, or we need to actually see you in the office. And I'm sure people have to feel safe and protected when they come to the doctor's office, and so that becomes your emphasis too.
Yes, I mean, and getting back to the masking policy, I mean, we're still masking all patients that come into the office, and if they don't have a mask, we can provide them with a mask. We are confident in the levels of PPE that we have for our staff and safety for the patients. And again, in a lot of our offices, they're open spaces. I mean, I could tell you, when I walk into one of our offices, I personally feel very safe just because I see the social distancing, I see the masking. I know that we're doing everything in our power to keep people safe.
Yeah, absolutely. All right, so let's talk about elective surgeries. They, of course, are one of the real keys to IRMC's viability as a community hospital, and they must be. So elective surgeries are now going to be allowed again, and that's going to have to be a phased-in process, right?
Absolutely. It is going to be a phased-in process. And in fact, we've been having surgical committee meetings in the last 2 weeks discussing this very thing of what type of reopening plan we would have. And again, as mentioned earlier, the nice thing is I was looking at the governor's reopening plan, and I mean, they're basically making certain that the hospitals have enough PPE for a potential surge and for surgeries. Make certain we have a plan in place for COVID-specific patients in our operating room arena, and also making certain that we've got some testing protocols in place and emergency planning. So the nice thing is during the last, I'd say, month and a half, we've actually been creating those protocols. We've been creating those plans that I feel pretty confident that we're pretty much there to start reopening, but at the same time, we want to do it slowly. We want to do it safely, and we also want to make certain that the patients are not put in harm's way and get a good outcome.
We're talking with Brett Braun, the IRMC Physician Group COO, who this morning is discussing a number of different ways as we begin to expand healthcare services once more and get toward whatever the new normal is going to look like. Brett, explain to us a little bit. We've got custodial staffs in every business, and certainly IRMC has its normal custodial staff. But when you get into medical situations such as an ER, an OR, all of those different things, that's really specialized cleaning, which means that it really has to follow strict guidelines, does it not?
Yes, I mean throughout the hospital. We report to governing body, the Department of Health and CIHQ, and we do follow the guidelines of cleanliness in the OR arena, in the ER arena, but also throughout the hospital. I will tell you that during this time frame, I would say that we have increased our janitorial efforts throughout the entire hospital. I mean, 3 to 4-fold, if not 5, if not more. And I think that that's important also to recognize. I mean, you look at the various departments in the hospital. I mean, they are clean routinely. We actually have a robot that uses ultraviolet light to clean. To sterilize our ORs and other big rooms. So for me, I feel confident in walking in the hospital that I'm going to be pretty safe based on the level of cleanliness there.
Take me back to that 7 or 8 weeks that it's been since all of this started to really hit home, and how it struck the staff there within the IRMC physician group, because I'm sure that they took a hit just like everybody else. It knocked everybody back for a second or so just to say, wow, this really is a real thing that's happening now. And compare that to the way that they move about now and the confidence that they have in being able to do their job.
Yeah, it's interesting, Todd, because I think since the beginning of this, there was a variety of emotions surrounding COVID-19. And I like to describe it, I mean, let's say there was a concern level or panic level of a 1 to a 10. And, I mean, I had staff that were at 10s and I had staff that were at 1s. And I was trying to identify the 5s. And we've been very accommodating to the staff. So for the people that were at the 10s and had concerns, we were doing everything in our power to show them that we were being safe and providing them the necessary PPE and also screening tools to keep them safe. And again, like I mentioned at the beginning of the call, to date, not a single IPG staff person, physician, and or patient luckily has not come down with COVID-19. So I really give that a testament to that. I mean, another thing to add, too, is when we first started, our testing capabilities were somewhat limited, but in a recent development with working with IUP, Dr. Pat Shannon and Dr. Barathon, who's the director of the bio department over there, they've worked closely together to get us a quicker turnaround. And so as the testing unfolds in a quicker turnaround time, that has also given us a higher level of confidence and a good messaging to our staff as well.
From an outsider standpoint, when that all developed, to me, it just spoke to the creativity of people in a really pressure situation to come up with a solution that is really going to work for a lot. And I don't know how it felt to you as an insider, but to me, looking at the outside, I thought, wow, that's just amazing how quickly people are able to come up with solutions.
Yeah, I mean, these are definitely trying times, but I can't tell you enough how impressed and how proud I am to work for IRMC Physician Group and the hospital. And I've seen people behind the scenes come together, get creative, and just have a laser focus to doing everything we need to do to keep people safe first, but also concurrently having a plan to say, how can we get care back to people? Because the one thing that we've always been concerned about were people delaying their care, were people not getting care. And as time went on, more and more of those discussions happened. And again, I couldn't be more proud of the physicians and the staff of the hospital and the physician group for getting to where we are today and where we're going to be in the future.
So speaking to the general public as a group, what is your message to them today about care at IRMC during this time and moving forward?
I think the message today is don't delay your care. Call your doctor, call your doctor's office. Getting care at this point in time is safer than ever, given all of the practices we've implemented. And let's try to take care of you sooner than later.
He's Brett Braun, IRMC Physician Group COO. Thanks so much for spending some time with us today. It's been great.
Thank you very much, Todd. I appreciate it. And everybody stay safe out there.
Have a great day.
You too. Bye.
There's Brett Braun. Wait for it. There's Brett Braun. Wait for it.